Well, hello, everybody. Hi there, it's Dr. Steve, and here we are with Kinesis, and today we are talking about patellofemoral pain. So everything is connected. The knee bone is connected to the hip bone connected to the spine bone, and everything is connected. And so patellofemoral pain refers to just kind of pain in the general knee region. So very often, if it's a specific kneecap pain, that is the patella. So the patella and the femur, the thigh bone here, they make up the patellofemoral joint. And so if there's pain in and around the knee, very often that's referred to as patellofemoral pain. And so when the knee is hurting, it's connected to the femur, and the femur is connected to the hip. The hip is next door neighbors and best friends with your low back. And so there are connections between the hip and the low back and the knee. And one of the things that often makes the knee painful is when there's tight stuff, and tight stuff, particularly in the front. So one of the things that we want to do when there's patellofemoral pain going on, kneecap pain, is we want to start to stretch out the front of the body. And so we're going to do our melt, mold, move sequence. And in the next part 2 and part 3, we'll give you the mold and the move. But today we're going to do some melting where we're going to really work on the front side of the thigh. So a couple of ways that we're going to do this. And actually, I think I'm going to scoot the chair closer to the wall here. I should have had this set up a little bit earlier, but we're going to bring this in closer to the wall because then it gives us something to hang on to, which can be really helpful. So one of the ways to stretch out the hip flexor is, one of my favorite ones is this this hip flexor stretch. And this is a great anti-sitting stretch because what we're doing is we're stretching out the front of this front leg, or this back leg, I'm sorry. But this back leg where the hip is coming back into extension, we're getting a lot of this front side going. Being next to something to hang on to is helpful because we want to go forward and back. We're going to go side to side here, and it's a little harder for you to see this, but I'm going in towards the wall and away. And then we can go in some circles, but circles are great, but I kind of even more like some twisting. And so we're going to rotate a little bit. This is getting the hip flexor of this back leg. And so obviously we want to do both sides. But then I want to show you another way that we're going to go about this. We're going to go into a kneeling version, and the kneeling version is a great way to really target the hip as long as the knee is okay kneeling. So after some forward and back, then we do a little side to side here, and then we're going to do a few twists back and forth. Okay, but here is where now we're going to go into a kneeling version. So I'm going to bring the chair over here so that I can kind of give you a good version of it, or at least kind of show you this angle. So I have a comfortable pad, a squishy pad. You can use anything, a cushion, a couch cushion is often great, or a pillow or something. But the couch stretch, the idea is the foot goes onto the seat of the couch or a chair, and then we get this much bigger bend in the knee, and that's going to target the stretch into the quads, and we're getting this hip flexor into the front of the hip quite a bit. And so as long as the knee is comfortable kneeling, and you'd be surprised, but actually very often this is a-okay for a knee that is sometimes painful. Kneeling on it actually works many times. You just have to make sure you do have enough of a padding there. So then we're in this couch stretch position. It is really helpful if you have something to hang on to, whether it's like armrests or an end table or an ottoman or a wall, or it doesn't matter what, but something is helpful. And then what we're going to do is we're going to do our stretches in the 3 directions. And so we're doing the forward and back here, and then we'll get into doing the side to side. So I'll give you kind of the example. If I turn towards the wall, and this is another way that you can do this same stretch, where now I have my foot up onto the wall. It's a little hard to see with the camera angle, but I have my foot onto the wall instead of onto the chair. And here in this same position is where we're doing this side to side motion with the hips. And then we're going to go into circles both ways. But that's to give you just this different little orientation, the different angle here. And if I kind of scoot back to having my foot onto the chair seat, then here we're doing our side to side and going around in circles each way. So this is getting the quadriceps, it's getting the hip flexor, it's hitting all of those parts. So I'm going to spin around so that I can do this other side. So because of all of these knee muscles that go down and connect to the knee, they start up into the thigh, or they start in the thigh and up by the hip. And so when we want to make life better for the knee, one of the things that we need to do is stretch out the hip. So here I'm facing the other way, getting the other leg so that you can see it. Foot is onto the chair seat or the couch, hanging onto the wall, and then taking the hips, going forward. We're doing this side to side, and then we're going to go in circles both ways. So the quadriceps and the hip flexors, they live on the front of the thigh and they blend together. The hip flexors up at the hip, the quadriceps, all of those thigh muscles, they all blend together into the front of the leg. And that's where when there's kneecap pain or patellofemoral pain, very often what's happening is the kneecap is getting a lot of pressure kind of being crammed into the femur. It rides up and down in this little groove. And when there's tightness in the front of the body, that creates a lot more just joint compression on that knee, as the quads and the hip flexors are just a little bit more flexible and mobile. That takes some of that pressure off the knee and can help it feel better. So that was part 1. That's our melt, mold, move sequence for everything being connected. We're talking about patellofemoral knee pain and how the knee bone is connected to the hip bone, connected to the spine bone, and on and on. But we are stretching out and melting kind of the front side of the body with the couch stretch and the hip flexor stretch is part 1. Stay tuned for part 2, where then we're going to add some lengthening to the front side of the body and all these tissues. And then part 3, where we make it a little more integrated, a little more dynamic. So if you or anybody that you know are struggling with some knee pain, send them into Kinesi and let us help find a solution for your pain and the freedom in your body to do whatever it is you love to do, to wiggle and move and enjoy and express yourself. Okay, until the next one, bye-bye, everybody.